Okay, you're gonna start it off.
I don't know what to start off with.
Just start it off, dude.
All right, today we're talking about tattoo removal. We're getting it started with tattoo removal.
You're so funny with the introductions. All right, did you get a haircut?
Yeah.
All right, looks good. Everyone's tattoo's so different because it depends on, did the artist have a heavy hand? Is it colored ink? When was the ink performed? Is it a cover up? Is it a one layer tattoo? How dense is the shading? So you've got so many different variables. And with physician's assistants and nurse practitioners, the protocols vary. And it also depends on your supervising physician. If you're anything other than that, you shouldn't be performing tattoo removal.
Anything outside of that tiny little bubble becomes convoluted and confusing, and without a basic medical background, especially if it's something that's going to affect patient outcomes like infection, inflammation, adverse skin reactions, rashes, etc. And with AI, it's getting better and worse because AA tends to be more accurate sometimes, and just as often as it's more accurate, it's less accurate because there's so much misinformation on the web for AI to draw from. There's a common... Oh, wait, I gotta take this one. I forgot. Hold on.
Live? You're gonna take this live? It's very important when you're doing online research that you type up your state, right? For example, can tattoo removal be performed by a nurse practitioner in Florida, in Texas, in Arizona, in New York? Because a lot of the treatments and services we perform, they vary between state to state. And then on top of that, your supervising physician requirements also vary between state to state and the type of practice you have. If a relationship wasn't like that, put in place like that, I don't know how I could feel secure being in the industry.
Yeah.
And I'm gonna leave it at that.
All right.
Because I guess
We gotta go. We're out of time.
Here. But thanks for tuning in on Inside Out Med, guys. We'll see you next week.
All right, today we're talking about tattoo removal. We're getting it started with tattoo removal.
You're so funny with the introductions. All right, did you get a haircut?
Yeah.
All right, looks good. Was it for the podcast or for A4M?
Both.
Right.
I needed one.
Are they releasing some new stuff there, or what's going on? What's on the agenda?
I mean, I looked at the lectures and not all that impressed with the topics.
What are the topics?
It varies, but it's a lot of stuff in BHRT and nothing all that revolutionary. I mean, they like to take segues. They have even lectures on how to select the right compounding pharmacy.
What?
Yeah.
You know, it's funny because they're all over the place. We've hit on that a couple times. But I think really the way to go is with 503B.
Mm-hmm. For people that don't know, 503A pharmacies are patient-specific, and 503B shipped to the clinic, and the clinic dispenses the medication to the patients.
You could just, monitor it more, right? I mean, like if you have a patient on a starting dose of anything, any type of GLP-1, right? They have leftover medication in their vial after their, monthly, even could be quarterly plan, right?
Mm-hmm.
Do you trust the patient to follow those directions? Like, because the philosophy with semaglutide and tirzepatide, Mounjaro, Ozempic, whatever you want to call it, seems to be, I'm hungry, take more.
Yeah, and well, a lot of people also come up with their own regimens. Like they'll start taking it once every 2 weeks, or once every 8 or 9 days, or twice a week, or they'll even see something online about daily dosing, or they call microdosing, which by the way isn't very effective, but and start doing just their own deal with it. Patients love to just create their own medication programs.
From your perspective, with all your years of experience, would you prefer to dispense pre-filled syringes to a patient or give them a whole vial?
Yeah, I think it's much easier to just do pre-filled syringes.
Do you think like
it's easier for the patient too, because they just grab? They don't. I feel like there's a lot of error too when people are drying up stuff. They drop air bubbles and they get incorrect volume amounts, and I feel like they run into all sorts of issues when they're pushing a needle into a vial and drawing up medication. You would think it's a pretty simple thing, but
Well, you remember the one patient that came to the office and that was out of you had the conversation with him out of testosterone, like the
oh yeah, they love to say that
pharmacy made
shorted them on the testosterone.
yeah.
Yeah, I mean that is almost, it's like saying that a can of Coca-Cola doesn't have the right amount of Coca-Cola in it. I mean, there's no way the volume's going to be off on that. But
How are you so certain in that?
because
Just
they
a
they
devil's
just do
advocate
it
here.
they do it like in such a high volume production. The machines and mechanisms they have to measure and
We just
prepare
trust our, I
the
mean,
vials with a vacuum, and everything is also weighed.
well, it also depends on the pharmacy, right? If you have a good relationship with the pharmacy, you trust your pharmacy, you know they're regulated
But
appropriately.
usually, if it's a fairly large pharmacy that's doing very high volume and dealing with a lot of, like Hollandale Pharmacy, they're doing like 20,000 scripts a month. They have so many safety mechanisms in place to prevent either incorrect dosing of medication, problems with sterility, etc. So they follow all the protocols for that, and then they're dealing with fairly sophisticated equipment that dispenses the exact same amount every time.
Well, you know what's funny within the wellness realm, right? You can look up a patient to see if they're using testosterone on eForce, or to see if they're actively on a testosterone script, and then you've got legit scripts who not only certifies the compounding pharmacies but also certifies the practice, which I think is great. I mean, you'd think they'd come out with something like that for aesthetics.
Yeah, patients don't know about legit scripts. It's like something within the industry that has to mostly do with advertising
It's
on
it's
Google.
mainly for advertising, right? So like your ads are gonna get flagged if you're in marketing and you don't have a legit script certification.
Exactly. Like you can't get a Facebook advertisement out or a Google where AdWords
And if you
won't
do,
work.
it's like makeshift, right? It's like skinny shots or it's like medical weight loss program, which still might even get flagged, but you're beating around the bush in terms of what you're actually trying to sell, trying to market.
What words you can use to market.
Yeah. The application is not as extensive as I thought it would be. I mean, you have to put a lot of detail. It opens you up to inspection. And when I read forums about it and other providers talking about it, same goes with when you register as a dispensing practitioner, you open yourself up to inspection. You should encourage inspection. I mean, I think it should be encouraged, right? Like,
Yeah, because
it shouldn't worry you. You should just want to encourage it, right? If the state, whatever state it may be, wants to come in and inspect your facility, your licensure, your policies, your protocols, you should encourage it, right? You should be able to lay everything out on the table and confidently be like, here's everything. This is what I do. If there's any errors, tell me about it. I'll fix it immediately.
From a business standpoint, I agree with you. But if you get into the nitty gritty of that with medical doctors, there's going to be a lot of pushback because medical professionals typically, and this is kind of a culture of medicine going back many years, don't want to be questioned and have to provide justification for everything they do.
Why?
Well, because
Someone's
initially
questioning your medical knowledge.
Yeah, but it's not just that.
What if it was from a safety standpoint, though, right? They just want to, so
from a safety standpoint, it's different. But
you're holding medication, you're dispensing medication, right?
But if you were to question
your operations.
every clinical decision a physician made based on a certain protocol he might be following or not following, how you can take that. You don't know that's a rabbit hole.
Well, I think it more so applies to someone like me.
Yeah,
right?
so I'm saying if you're talking about a business practices.
XS is a business too.
Yes.
Right, but it's not physician operated, right? Physician oversight, physician supervision, but there isn't a physician in control of the ship, right?
Mhm.
Where XS, you're in control of the ship. So you make every single decision based off your judgment, whereas I would make every decision based off of my judgment. However, from a medical sterility, safety, compliance standpoint, what's the problem with inspections for all practices?
No, I think there should be. There should be inspections.
I mean, think about it. When was the last time the state actually came in and performed an inspection? We
The
were talking
only
about that.
inspections I get are for fire regulations
We were
and
talking about that.
biomedical waste.
Yeah. Biomedical waste is great, and I think that's very important because you're dealing with, bloodborne
But
blood
why don't
pathogens,
they take
everything.
it
Needles,
like at
sharps.
least extend that kind of inspection to ensure that places have medical directors,
I mean, but then
licensed
we're playing a political battle at
mid-levels.
that point,
Yeah.
right? Because then it's like, what's going on with taxes? Because they're state employees, or even if they're government employees, federal employees, then you're playing a political game. However, if you're a provider, I think it's important to be registered as a dispensing practitioner.
It's getting. I know we brought it up before, but I'm so annoyed. Every time I drive down the street, I see 2 or 3 new places opening up.
Yeah, but
medical weight loss, IV therapy, hormone replacement.
They don't survive.
I
don't think they survive, right? Because everyone comes into this industry and thinks like there's such a massive margin. Why? Like where are they creating this over? I don't know if I'm doing something wrong, right? But they're making it seem like you've got 100x returns on every plan you're prescribing.
But if you
selling.
do things legitimately, right? If you follow the laws and the regulations, there's going to be a certain threshold for your overhead. These places that are cutting all these corners obviously have a much lower, but they have much lower overhead. So will they survive or not? Maybe they will survive because they literally have no overhead. They don't need a medical doctor. They don't even need a licensed PA, or they just have some back alley place giving them medication and they're dispensing it to people that walk through the door. I mean,
you know what's crazy? Think that brings you back to tattoo removal. If you're not and with physician's assistants and nurse practitioners, the protocols vary, and it also depends on your supervising physician. If you're anything other than that, you shouldn't be performing tattoo removal. I've read enough regulations. I've seen enough statutes with the state because we were talking about that last episode. So we acquired the Toro. It's great. We're going through all the learning curves and all the different modalities of the device because it's so customizable. And everyone's tattoo is so different because it depends on, did the artist have a heavy hand? Is it colored ink? When was the ink performed? Is it a cover-up? Is it a one-layer tattoo? How dense is the shading? So you've got so many different variables. But I've made the executive decision that, and because we have so many electrologists and that are also estheticians, facial specialists, and the academies give them this tattoo certificate, right? So they're all like, we have a tattoo certificate. We've got a tattoo completion training certificate.
What is that, like for doing eyebrows or something?
No, for tattoo removal.
Oh, it's a tattoo removal certificate?
Tattoo removal certificate from the academies that give them their licensure to be an esthetician, to be an electrologist. It's like CME, CC, LME. There's a couple of different abbreviations for it. And I'm like, no, I don't need to get an attorney involved to be like, I mean, it looks pretty black and white. I've sent a couple emails with the state. They were very, very supportive and transparent. Like, read this, read this, read this. I mean, it's black and white. If you're not a mid-level with proper protocols and a proper flow put up in place with supervision, then you shouldn't be performing tattoo removal. And I could probably name 10, 15 different clinics that I know that are doing it. That don't even have a mid-level on staff.
Wow. Yeah, it and that's just the tip of the iceberg. That's for laser stuff, but I mean, it extends far beyond that. But you would think it would be that kind of thing would be slowing down. I think it's just picking up.
It is picking up.
I see
and
new places opening every day.
That's why we're having the podcast, though, right? Because it's like to try and spread awareness. I mean, we've talked about it. I had serious compliance issues, big, because it was the unknown. I didn't know. So I like to give people the benefit of the doubt, where I wouldn't be so honed in on compliance if it wasn't for everything that I went through, and we will talk about that at a later episode.
I
But
think there
but
should be
they
some.
don't know. I mean, like, think about it, right? I just don't think they know. Like, everyone else is getting away with it. It seems like it's okay to do. Why shouldn't I be allowed to do it? That is the way I look at the industry as a whole. And that's why, I mean, we're coming on here trying to provide some answers based off of our knowledge.
I mean, I know people don't like whistleblowers and stuff, but I feel like there should be some website for reporting these new pop-up.
I mean,
They're
you could.
literally no
Here's
different
the
than a
thing.
pop-up place that does
But here's the
your Uber
thing.
Eats. You know,
Here's the thing with that, right? Because you could go online and make a complaint against a provider. You can. Like, you can go make a complaint against any provider, and the state has the responsibility to go investigate that, and they will. They will go investigate that complaint. However, I don't think that solves the issue, right? Because in my opinion, if you're just going to go complain against a bunch of providers, right, it still leaves everyone else uneducated, because how big does that scenario really blow up, right? You go make a complaint, they fix everything, it's done, and then that situation goes away.
it's like if you have all these parking spots that people are parking in illegally and nobody ever tows the cars from those parking spots, it's going to be a problem that those parking spots are never utilized for people that are supposed to park there, right? Until people start seeing those cars getting towed away and there's like some actual consequence to breaking the law, that I don't think there'd be any attention paid to that to doing things properly. I mean, it's got to get in the news where some of these places are getting shut down for operating
It is.
illegally,
I
and
think
I
it
don't
is.
feel like it hardly gets any attention.
So I mean, with attention comes expense, right? I mean, like, you got to have the right people involved. You got to stroke checks. I mean, like, the news outlets aren't reporting for free. They're reporting to hopefully gain traction, right? To develop a compelling story that individuals want to read. So, I mean, and I think it's worse the further south you get, right? Because we're up in the third location in Vero, and there's a couple clinics there, and some of them seem pretty legit. Some of them seem a little less legit. But what I always tell the providers and the patients is, like, when you're purchasing a procedure or a treatment, or someone's prescribing some sort of program, you're not just investing in yourself. You're not just investing in the provider. You're not just investing in the company. You're investing in the administrative team leading that company,
Hmm.
right? So when you look at all of that, because, like, when we go places, or if I'm purchasing something, I look into it, right?
Hmm.
When you look at all that, do you feel confident in your safety, compliance, and the purchase you're making? And one of the biggest things I looked at was body details with their whole bankruptcy. I mean, that new pizza shop, just I didn't know that they were there. So we just had
Yeah, we just
a
went to
slice of
this.
pizza right next door to the podcast studio, because Cole didn't want to show up for our podcast. So while we were waiting on him, we were grabbing a slice of pizza, which is just right next door. He opened up a couple weeks ago. Great pizza. And it was Body Details.
Yeah.
And they went bankrupt. And we acquired a bunch of clients from them, because they're like, listen, and we're big on Lifetime, the Lifetime laser. And they had a pain when we were telling them about that package, right? I can't commit to paying a monthly membership, or, like, commit to a contract, a financial obligation, because I just got so screwed by this company
Oh yeah.
that closed all their locations. And I was like,
What about doing some kind of advertising where you're like, we'll
yes,
take over your
your existing
contract?
package.
Yeah.
Yeah. And, we don't know what went on inside of Body Details, right? We don't know what the closure was for. It only gives so much information in the bankruptcy. But, I felt for those patients. Like, could you imagine that, right? So, I kind of felt that, because I've used the same security guy who installs all my cameras. I don't know if I told you this. for all the locations, and so I paid him, and I pay him with checks. So he doesn't have to, he's like, I don't want to pay the credit card fees. I don't want to impose it on you. So I trust to give him a check, right? And he's a good guy. He's always fixed everything, and we're having a lot of problems with some of our security systems. They're all up and running, but just like glitches with using the software, and I needed to get him involved, and I didn't hear from him for like a week, and I'm like, asked Vlad to reach out to him, and I couldn't get a hold of him. Vlad couldn't get a hold of him, and then someone calls Vlad and was like, he passed.
No way.
Yeah,
really?
he passed, completely passed away. Condolences to him and his family. But I'm like, now he's got all this money that I prepaid him for Vero, and I'm like, what do I do? Right? So I'm like, it's like, do you want to get an attorney involved and like go after a widow, right? Because that's horrible. Like, it's just like sad to have to do something like that. Or could you try and formulate some sort of agreement? And, I was on a personal, like we're on we have a good communication. We have great communication, right? So I'm speaking with the owner of a company. All these patients of body details, they don't know though. They can't get in contact with the owner of the company. They can't get in contact with the owner's significant other of the company.
Yeah.
So it's like they're just flat out screwed.
Yeah.
So why would these patients trust a practice like that? That's another thing, right? So you've got to at the end of the day, you've got to put some of it back on the patient, right? Like there's no MD, there's no CMO. I don't even know if any clinic, I mean, maybe the bigger ones, right? Do you think anyone has a chief medical officer?
No.
Like, do so it's like, I don't know.
But I've heard this typical scenario play out before where maybe Body Details was a fairly large operation, but I mean, some of these ones that have 2 or 3 locations and they're not doing well, they'll go on a tear where they sell a whole bunch of packages
And then close.
Overnight. They'll pull all their stuff out, literally close overnight.
You should be arrested for fraud. I mean, that's fraud, right?
Yeah.
I would say, if you look at that case scenario where it's like massive flash sale, business closure, bankruptcy, non-restructure of debt, you should be investigated for fraud.
Oh yeah.
I mean,
I'm sure at some point they do, but I think a lot of them get away with it.
I don't know why, and we may never know why. I mean, this podcast could potentially go nowhere. We could just be sitting here having a conversation and get 3 views indefinitely. But at some point, right, there needs to be some sort of attention towards all aspects within health, because there's going to be negligence and fraudulent individuals in every industry, but we're the only industry that deals with human life.
Yeah, I mean, obviously there's adverse events that will frequently affect people's lives in this business. I just had a patient yesterday that had occlusion of the facial artery, and like literally half of her face became necrotic. And the provider sounded like he did some things right, and he knew this happened at the time of injection.
Wait, this was your patient that went to see another provider?
No, a patient I saw for the first time yesterday.
Okay.
Their previous injector.
Florida-based?
Yeah. As an occlusion of the facial artery, and she had necrotic tissue for a large portion of half of her face. But due in large part to the fact that this guy, the very next day, had a trip planned and left the country and didn't arrange any follow-up for her.
That's insane. So remember I was telling you about it with the inclusion we had on Halloween, right? With one of the providers. And the patient just actually reached back out to me, and she was like, hey, I know, you've got provider Tennessee from PSL's going up to Vero Beach. She's like, I know Tennessee's going up to Vero Beach. I haven't seen her yet. Do you think I could come back in and get refilled? And it was because of the trust on how the emergency was handled that, I mean, I'd like to think these patients would never leave. When we have emergencies with patients, everything's set up so perfectly to, knock on wood, that we can adequately handle the situation. And I mean, when I called the provider met me at the office. We were there at, 12:30 night to 2 in the morning. But I mean, the providers don't even blink. They're like, okay, let's go. You know,
Yeah.
they're like right now, because it's so. I mean, you would know best.
It's better to
How
overreact than underreact.
how
Yeah.
urgent is it with a vascular occlusion? Like with time, with the
Yeah. I mean, it's obviously like anything that's an emergency. The sooner it gets resolved, the much better outcomes.
why even
And if a
guess?
vascular occlusion occurs and you manage it appropriately, very quickly, I mean, you should have very minimal um, tissue damage and pain and suffering for the patient. But
But
if a couple days goes by, then you're running into some serious problems.
it's great now though, because I don't know. I obviously now we have the hyperbaric chamber
Mm-hmm.
for tissue repair,
Yeah, that's like the perfect application
right?
for people with tissue damage secondary to vascular occlusion.
So like if something were to occur, even if a patient ever even thought like whether they went to another clinic, another injector. I mean, let's talk about hyperbarics for a second
Mm-hmm.
for emergency protocols.
Yeah, it's helpful in almost every protocol where you have either inflammation, infection, necrosis, um, that can obviously result in permanent disability or scarring. I mean, it's a huge benefit to have that as one of the tools in your arsenal to combat adverse outcomes, or even to serve patients that have had adverse outcomes somewhere else. You could even put in an advertisement out there. Has this happened? Come here to receive treatment. For these types of situations. Um, Not only that, but hyperbaric oxygen works great for recovery from like severe ablative laser procedures
For
or
like post procedure treatment plans
Mhm.
on top of the topical stuff.
even plastic surgeons that aren't
It's very
very,
common actually.
yeah, a
Yeah.
lot of plastic surgery offices offer it as a pre and post treatment for surgery.
Yeah.
I don't know why they all don't. They really should do it, but
There it seems to be that I mean obviously there's a bigger investment in it, right? With medications, I mean there's no investment. There's no real investment in medications, right? If you're just actually prescribing or not dispensing anything, like
Mhm.
supplies, like a McKesson account, Medline account, Henry Schein account. I mean, it's relatively easy
Yes.
to start that up. And I find it abnormal that there's so many HRT clinics or like you go online and get testosterone and whatnot, and there's no doctor on board, zero.
Hmm.
It's just nurse practitioner or maybe PA.
And the way that was set up it was not intended for them to be practicing independently, and it's like just slowly become somewhat acceptable, and I don't understand why.
So it's like, what do? You go online and you report every provider you see,
Oh no.
right? I mean, like, think about that. Like, what do you
I
do?
mean, in all fairness, there's a massive clinical gap in knowledge there. There's also a massive uh, gap in the knowledge-based requirements to achieve licensure from being a medical doctor to a PA or a
Well,
nurse
also
practitioner.
everyone thinks they could just have like we were saying with the tattoo certificate, like it certifies you, like it's you're done, you're good.
Yeah.
Well, let's speak for a second. The trainers that came in for the tattoo removal training, I mean, you had some pretty hefty opinions on them specifically based on their knowledge on tattoo removal and that device
Mm-hmm.
and specific.
Yes. Yeah.
So how do you think that's okay? Right? Because like you have a regular practice, normal practice. One, I don't think a manufacturer should be allowed to sell a device willingly knowing that there's not someone who can actually operate that device. I don't think that should be allowed, right? Because
Hmm.
I mean they all do it.
There's an arrogance that comes from these either trainers or sales reps that are working for a company that's selling a specific device, and they think they know everything about it until they don't. right? Until there's an outcome where they don't understand the pathophysiology of it, they don't have the medical background to speak about it, but
Let's
they think
let's
they're
dive
experts
into
on
this
it.
specific example with Danny, right?
Hmm.
She's a an electrologist, facial specialist, esthetician at Refresh, incredible provider. She was getting a tattoo removed by one of the mid levels in the training.
Hmm.
Talk about it.
So it appeared that she received a fairly standard treatment for tattoo removal that resulted in a burn. With most of these types of burn, laser burns are either first or second degree, or they're like first degree burns, secondary, and bordering on second degree burns. And in this particular case, it was like some areas were first degree, some areas were second degree. And this trainer had told your employee to that it shouldn't be hurting this much, 5, 6 days out after the initial treatment, and that she most likely had an infection and needed to go to the emergency room. And
Emergency room for what, though?
for IV antibiotics.
Okay.
Yes. And when I heard about that, I thought it was crazy because, I mean, first of all, what is her clinical acumen to make the distinction? What requires IV antibiotics versus oral antibiotics? The patient was or the employee patient
Yeah.
was already on oral antibiotics just in case. And it turns out, through some follow up, you know, monitoring care, there's no infection at all. It was just a burn.
What did the emergency room do?
Nothing.
Nothing.
And people have this superstition that if you go that's just the same thing as having a sick baby, like a baby with a fever. Oh, let me take it to the pediatrician. You get an emergency appointment with the pediatrician. The pediatrician, well, he's got a fever. Give him some Tylenol. Like people have this superstitious belief that when you go to a physician or a specialist or to the emergency room, there's going to be a magical cure. Most of the complaints people go for or just need observation or reassurance or just basic common sense management.
And I think, because this is a real recent scenario, right? It's
Mm-hmm.
real, it's recent. I mean, how many cases like this you think are going on throughout the states, throughout the globe, even for other people in other countries, like having treatments performed, like, I mean, with inadequate recommendations from
Yeah.
people who should not be talking about it.
Yeah. I mean, that's a problem when you have the peanut gallery getting involved and
Oh my
submitting their opinion when really it's not warranted, necessary, or reliable.
So
And
that's the thing, right? So like what you've got a company who's got a certified, I mean, a mid-level nurse PA.
uh-huh.
It's coming in. They're obviously intelligent enough to be performing the training in that massive company. These are big companies.
Yeah.
These aren't little companies. Like that's just
Yeah,
these are
multi-million dollars, sometimes billion
billion
dollar
dollar
companies.
They're big companies, right? So based off of their professional knowledge, this person's well equipped to come
Train.
certify all the employees, get them trained, get a good understanding. I mean, I just don't ever think that's the case. I mean, like we've had and that's with all device companies, even with some of the products, right? We have a couple training. We have multiple trainings throughout the years, tons from all different manufacturers, products, etc. And some of them are just not there. It's like it's almost damaging in a sense to where it's like this is the way this should be done, and it's just so clinically incorrect.
Yeah, you're right.
Or inappropriate and the only reason that I can say that is because they're creating a rule book or a guideline that's trying to be one size fits all, and it's not one size fits all and never will be one size fits all, right? So I mean, you'd think you would get some very intelligent individuals in for these trainings.
No, I mean they may be good given like a very strict, structured kind of worksheet on what they need to educate their providers with. But anything outside of that tiny little bubble becomes convoluted and confusing, and without a basic medical background, especially if it's something that's going to affect patient outcomes like infection, inflammation, adverse skin reactions, rashes, etc. So I mean, there's there's the very well defined situation which they may be very proficient in, but anything that comes outside of that little box, and they, of course they might be trained about common reactions, etc., but they're not really trained on how to assess the severity of a reaction or the appropriate treatment for a reaction. And that's where they start offering opinions that are misguided and completely out of whack.
What about Dr. Google though? I mean, I think that
Same
plays
thing.
that's a big play right now, right? It's like
And with AI, it's getting better and worse because AA tends to be more accurate sometimes, and just as often as it's more accurate, it's less accurate. Um, because there's so much misinformation on the web for AI to draw from.
I mean, here
Uh,
I'm gonna kind of roll here. How are you so good at what you do? Like based off of all the procedures you perform, absolutely everything. How are you so good at what you do? Like
well,
what got you there? Like what is it? Like why are you so good at what you do?
there's a common. Well, wait, I gotta take this. Hold on. I forgot. Hold on. Hello.
Live, you're gonna take this live. All right, guys, I'm gonna hop on here while he's on this phone call. So, a couple different things is you've got all these manufacturers out there piggybacking off of what we were talking about, and at the end of the day, they just want to be profitable. They want to make money. And if you look at everything from a liability and a safety perspective, it'll help you continue to care for your patients and grow your business or book, or if you're an employee at another clinic, treat your patients more safely and more effectively. And it's very important when you're doing online research that you type up your state, right? For example, can tattoo removal be performed by a nurse practitioner in Florida, in Texas, in Arizona, in New York? Because a lot of the treatments and services we offer, perform, they vary between state to state. And then on top of that, your supervising physician requirements also vary between state to state and the type of practice you have. You know, at Refresh, we our most common service is laser hair removal. We do a ton of it. However, on some days in Jupiter, we swing towards more aesthetic services, meaning like Botox, derma fillers. You know, I even classify like microneedling, anything skin veers into aesthetics. So because of that, um, and I think I hit on this a little bit, we brought on plastic surgeons, but the only reason I found out about that regulation was because of a news reporter. A news reporter reached out to me asking to do an interview, so I did the interview. And he was he was asking about, and this is what really honed me in on the statute, about the physician requirements or MD negligence to just like, yeah, I just supervise even though there's nothing actually in place. And it really dialed me in on that regulation, which is why everything was restructured in a sense of having multiple plastic surgeons on board, having an incredible physician on board who specializes in regenerative medicine, and then having, you know, Chris here as, you know, the highest of the medical executive board, being a chief medical officer, meaning, you know, if you have a plastic surgeon in an operating room, can you get a hold of them right then and there? No, maybe not. Hopefully you can, but if you can't, go to the CMO, right? Because he's going to be able to help you with it right then and there, address it so that everything is handled safely. With that being said, when you're doing your own due diligence, make sure you're incorporating the actual state that you're in, because it varies between state to state. And some of these manufacturers, they just want to sell their product, sell their device, sell their technology. And when it comes down to it, if something happens, like they're not going to defend you, right? They have no reason to. Then how was your phone call?
Well, it was important because my AC stopped working.
What?
Yeah, and I had to get
You didn't tell me that
Yeah,
today?
yeah.
At the health side or the aesthetic side?
MedSpa side, yeah.
What?
Yeah.
How hot is it in there?
It was 81 degrees when I left.
Dude, you're kidding.
No.
Is it your responsibility or his?
Mine.
No.
So I had to call this AC guy and
I've got a really good AC guy.
oh, this guy's good too.
Yeah?
It's way up in the ceiling and there's no platform there to like
Where else would
work
it
on
be?
the AC.
It's always in the ceiling.
Well, there's
building
two
like that.
components. There's the
I guess you can have it
exchanger and the
outside.
one on the roof. But yeah, he's got to build like a platform to
You've
work
got a
on.
problem with AC. Even the one in your garage is just atrocious to get to. How do you even get to that thing, dude?
It's so stupid. I got to like peel off the foil tape. I don't know how this passed code. And like pull out the filter and then put the tape back on.
You know what's crazy with everything we're going through with construction? It's
I know.
Inspection, regulation, regulation,
And everything's still done so badly.
and it's still like, but
yeah, I
No,
know.
you know-
Amazing.
remember? I don't know if I told you this. So remember when I replaced all the doors in my house?
Yeah.
Exhausting process, but especially because I didn't think all of my bathroom doors were going to be different sizes, and every single bathroom door was a different size, and I only measured one bathroom door, all different sizes. Had to send them, and you can't return it. I had to sell them because they were custom made. I told you about this.
Yeah, I remember. Yeah.
And I hired a painter to come out because I didn't know that your doors don't come painted. So that's the next thing. You order doors, you get them installed, nothing is painted. So then nothing was painted. Hired a painter, came out, paint. I gave him 50% on the first day. Stopped responding, never came back.
That's funny. I didn't know that.
Yeah.
That's the guy that gave you a good deal? Or no?
I mean, they were all good deals, right? I mean, like, I don't even think it is a good deal. I think it is fair value.
Oh, I feel
Fair
like
value.
that guy just decided it was way too much work, right?
I don't
And
know. He was just like, I've got money. And he didn't. The thing was, I paid him 50%, but he completed 7%.
Oh, he didn't complete 50%.
No, I was just
Wow.
thought it was. You'd think, common practice, 50% seemed reputable. Trusted the guy. Definitely not the case. I mean, that was kind of crazy. So what are you gonna do about your AC?
He's working on it. I told him work on it till you're
He's working
finished.
on it now.
Yeah, right now.
Wow. You think you have to put a new unit? Or you think it's just
No,
like
it's the blower motor, but to get to it is a real huge production.
It's that bad?
Yeah, because it's like free floating in the ceiling. Like they have to build some kind of platform to work
How
on
did
it.
that pass code?
Exactly. It's stupid. There should be some kind of platform to work on it.
That's kind of crazy.
What were we talking about before that got that phone call? Because it was a good point you're bringing up.
I don't know. Oh, how did you get so good at what you do? I mean, I know there's one answer, but I want to hear the answer that you're gonna give me right now. It should be short. Like I'm looking for one sentence, not a 500-word essay. Yes, one sentence.
No, it's a combination of things.
Yeah, no, I understand. Yeah, but I'm looking for one particular sentence.
Common sense,
No, how did you get so good at what you do?
experience.
Trial and error.
I mean, you try not to err too much in the course of taking care of patients.
Yes,
but
of course.
it is like an experience-based thing where the only way to learn really well is just to go through
and
a
if there is-
thousand
if there-
iterations
but
of
if
the
there-
same thing.
If there is error, you handle it appropriately.
Of course,
right?
yeah.
I mean, like how else? Even with anything, any skill set, whether it's medically related or not, I mean, it all comes down to attempting and continuing to perfect your craft. What was your combination of things? I'm curious to know.
Well, I think when I was doing my residency, I moonlighted in the emergency room and
enjoy
not
that?
not an emergency room like in a
Was it
like
did
in
you
a big
enjoy it?
hospital. It was like at a resort town. Like I had to drive an hour and a half to get there. It was like this small resort town, but it was kind of cool and isolated. And it was this old hospital, and there was no backup. Like I was the only doctor in the whole hospital. It was a small hospital.
Did you enjoy the emergency room?
Yeah,
Yeah.
but it was very stressful at times too, because you have no backup. You don't have any other specialties to help you out. You don't have a radiologist to talk to. You don't have, orthopedic surgery to consult regarding a displaced fracture or anything. So
is this when you're driving your Maserati and got pulled over or something?
Yeah, that was one. But so you learn real quick how to like get through situations on your own, and part of that process is not only like doing the due diligence to get the medical information to make a correct decision, but also how to manage things from a common sense standpoint. Like, what's the quickest way to arrive at a solution to this complex problem? Like, how do I stabilize this patient and get them transferred to a larger medical center to be taken care of, et cetera? All of those things, you have to make very quick decisions on how to solve an issue where someone's life depends on it. And I think through that process, a lot of common sense approach came into my decision-making apparatus. And then in combination with that, having a strong internal medicine and a little bit of an emergency medicine background, combined with, all the aesthetics experience I have in wellness and aesthetics, it's kind of a very good kind of combination of things.
What made you get into the field?
I was always interested in it. I had a
more in aesthetics or more in
initially
more in
aesthetics. Wellness became something that kind of blossomed throughout the course of my medical career. Like, it wasn't a thing at the forefront of medicine in the way it is now, back like 15 years ago. But
if you think about it, I mean, just about every practitioner, and there's of course, anomalies to that, but they want to get into the aesthetics and wellness realm. I mean,
part of the reason people get into wellness, especially practitioners, is because they see what happens as they age, and they're like, "Wow, I want to do whatever I can to combat that." And just like, speaking personally, you go through a lot of little benchmarks throughout your life where you experience certain symptoms at a different age, and you're like, man, I want to feel the way I did like 10 years ago, 5 years ago, or 15 years ago.
What age were those benchmarks at for you?
They're at every like 5 years, basically. Even if you go from 25 to 30, most people notice a drop in something.
I don't think I've hit that yet.
Yeah, you're still at the age where you're still safe, but you're going to start seeing it once you get into your 30s. And then it'll be like some new symptom that you've never experienced before, or some new pain or ache that you've never experienced. Different type of headache, a different type of joint pain. I mean, it varies. It from joints to illnesses to cognitive issues. I mean, there's a lot of things that change as you get older. I mean, you might become more cognitively adept in lots of situations through the course of experience and learning. But there are some things that don't come as easy to you as they used to. So, yeah, it's a constant coping mechanism.
We're in the right industry to be coping with it, right?
Mm-hmm.
You know what's funny is, like, after hearing all that, right, or for someone hearing all that, you would think, my opinion would be, you acquire a patient, that patient never leaves, right? Because like, think about that. We said it in what, a 4-minute spiel, right?
Uh-huh.
In the beginning, I got it out of a sentence, but that's over years, like a decade. It's like decades, plural.
Yes.
Of time.
Yes.
To properly format your opinion.
I mean,
how to prescribe, how to operate, how to treat. And that goes for all the providers actually.
And that doesn't just go for medicine. I think that goes for pretty much every craft out there.
But that's when it comes to a value standpoint, right? Like, I mean, it's like people are treating it like there's no expertise involved with it anymore.
You're right, because it's become so diluted.
Do you think that's just in our? I feel like it's. I try and be like that's in other industries too, like to make myself feel better about it, because we were talking about the statistic, the McDonald's statistic, but then Vlad pointed it out to me. He was like, well, you got to realize something, right? There's more med spas than McDonald's, but there's not more med spas than McDonald's, Wendy's, Culver's, Burger King, all of the, because they're all competing,
Yeah.
right? McDonald's isn't necessarily competing within itself. I mean, guess franchises, of course. But do you think that's just within our industry, or like, I mean, because think about it, it's HVAC. How many HVAC companies are there? A lot, like a boatload. I don't think there's more med spas than HVAC companies. there's no
Or
way.
impact door company or intact window companies, roof companies,
Yeah.
seawall companies.
So do you think
I mean,
like, because when
but those are things that are more relevant to Florida, right?
what
I don't know
HVAC?
if there's a good reason why aesthetics is more relevant to Florida.
What do you mean?
Well, I mean, you have seawall companies, you have roofing companies, and you have impact window companies, particularly important in the state of Florida because of hurricanes, right? But I mean, why? Because it's sunny here, we care about aesthetics a lot more. I don't know why
Well, I
there's
don't
this
think
massive concentration of med spas in Florida.
I don't think Florida's the biggest state anymore. We were talking. I think
Per capita, it is.
Is it though?
I think it is. For not just aesthetics, for wellness as well, I think.
Maybe just.
Just like it was the biggest per capita for like the opioid crisis.
But I didn't know that.
Yeah.
Was it really?
Yeah.
Wow. Well, so like, I mean, when you look at the opioid crisis, you think this is a spitting image of it. I mean,
Kind of.
it's the same thing.
Because it's completely out of control.
It's so out of control. And in my opinion, if you're going to a clinic, or if you are a clinic, that's just, operating without any protocols, procedures, licensure, insurance put in place. I mean, that is a ticking time bomb. Why would you even want to invest in something like that? Right?
I agree.
And maybe it takes some experience to go through to like, learn that. But I don't foresee why anyone would want, like, why is that the industry you want to go into? I wouldn't. There's no way I would. If I knew what I knew now, after everything that I've gone through, I mean, like,
You would have picked another type of business.
I think I might have, dude.
I mean, I think you would have been very successful in any business you went into, but I think it would have been easier to scale another business than it is to scale.
I mean, I love what I do, right?
Yeah.
Employees want to be there, which I highly appreciate. They're so intelligent, great individuals. Patients want to be there because they love what they're getting. But I mean, dude, it's hard. Like, it's so hard. And of course, anything's hard. You want to be successful at anything, it's going to be hard. But one, I come from a finance background. I don't come from a medical background, right? If I didn't have a relationship with someone like you, I mean, it's like, who do you go to, right? We have great relationships with the other supervising doctors, but like, I trust your medical opinion more than anyone else's, anyone.
Mm-hmm.
So it's like, I know the patients are safe, not just with the providers, but if something occurs, you can get involved, right? So if a relationship wasn't like that, put in place like that, I don't know how I could feel secure being in the industry.
Yeah.
And I'm going to leave it at that.
All right.
Because I guess
we got to go. We're out of time.
But thanks for tuning in on Inside Out Med, guys. We'll see you next week.